Thank you for tuning in to the June edition of the AJP Video Table of Contents, or From the Editor's Desk. This month, AJP brings you a vast array of cardiovascular research, some of which is highly translational. In this month's issue, we've published 4 reviews, 7 editorial focus pieces, and 9 original research articles. I've selected just a few to highlight, so let's dive in. Et al. Provide an interesting review on a population neuroscience approach to study small cerebral vessel disease. In this review, they summarize the literature on aging of the cerebral microvasculature and propose a conceptual framework to fill existing research gaps and advance future work on the heterogeneous phenomenon. They argue that more resources should be invested in developing methodological approaches and basic science models to better understand the pathogenic and etiological nature of age-related brain microvascular diseases and implementing state-of-the-art population study designs that account for the temporal evolution of cerebral microvascular changes in diverse populations across the lifespan. The second review, Bose et al. Discuss sex differences in abdominal aortic aneurysm production and rupture. AAA is a multifactorial disease and the etiology is still not fully understood. AAA is more likely to occur in men, but women have a greater risk of rupture and worse prognosis. Here they review the present body of research on AAA pathophysiology in humans, animal models, and cultured cells with an emphasis on sex differences and sex steroid hormone signaling. A third review by Thoren Trescasas et al. Discuss the mechanisms of age-related decline in cognitive function and cerebrovascular disorders. They especially concentrate on the influence of pulse pressure on cerebrovascular events. They review the role of pulse pressure on endothelial dysfunction that may slowly develop in parallel with the accumulation of pro-inflammatory senescent cells and oxidative stress, generating cerebrovascular damage and remodeling, as well as brain structural changes. Here they review data suggesting that age-related increased peripheral arterial stiffness may promote the penetration of a high pulse pressure to cerebral microvessels, likely causing functional, structural, and metabolic and hemodynamic alterations. Final review, Butke et al. Review mechanisms responsible for the clinical translation of myocardial conditioning. They discuss mechanical conditioning strategies, including local and remote ischemic pre, per, and post-conditioning, which have demonstrated consistent cardioprotective capacities in experimental models of acute ischemia reperfusion injury. They discuss remote preconditioning and the potential of extended conditioning strategies to improve physical rehabilitation, not only after an acute ischemia reperfusion event, such as acute myocardial infarction and cardiac surgery, but also in patients with heart failure. Arimura et al. Investigated the function of myosin light chain phosphatase small subunit HSM21, HSM21 in vivo, and the causative role of abnormal calcium sensitivity in cardiomyopathy. They generated transgenic mice with cardiac-specific overexpression of HSM21. They confirmed that HSM21 increased the calcium sensitivity of cardiac muscle contraction in vivo, which was not followed by an increased phosphorylation of myosin light chain 2 isoforms. HSM21 transgenic mice developed severe systolic dysfunction with myocardial fibrosis and degeneration of cardiomyocytes in association with sinus bradycardia and atrioventricular conduction defects. Their findings suggest that the overexpression of HSF21 results in cardiac dysfunction and conduction disturbances via non-myosin light chain 2 phosphorylation-dependent regulation. Melter et al. Described the effects of a missense mutation of the cardiac myosin binding protein C. They expressed the pathogenic W792R mutation, substitution of a highly conserved tryptophan residue by an arginine residue at position 792 in mouse cardiomyocytes lacking endogenous myosin-binding protein C, and studied the functional effects using three-dimensional engineered cardiac tissue constructs. This study is one of the first to describe a disease mechanism for a missense mutation in cardiac myosin binding protein C linked to hypertrophic cardiomyopathy. The mutation decreases stability of the fibronectin type 3 domain and results in substantially reduced mutant protein expression dissonant to transcript abundance. Besnier et al. Investigated protein tyrosine phosphatase 1 beta inactivation on aging-associated cardiovascular dysfunction. Wild-type and PTP1 beta knockout mice were allowed to age until 18 months, compared with old wild-type mice in which aging increased the LV mRNA expressions of PTP1 beta. Old PTP1 beta knockout mice had reduced cardiac hypertrophy, lower LV fibrosis with decreased mRNA levels of transforming growth factor 1 beta and matrix metalloproteinase 2, and higher LV capillary density, a higher rate of proangiogenic M2 type macrophages, and a stable LV mRNA level of VEGF receptor 2. They conclude that PTP1 beta inactivation slows aging-associated LV remodeling and dysfunction and reduces endothelial dysfunction in mesenteric arteries. Thank you for watching the June edition of From the Editor's Desk. If you will be at the AHA Basic Cardiovascular Science Council meeting in the late part of July, please stop by and say hello to our team. We look forward to seeing you there, and I hope to see you again next month. In the meantime, keep reading AJP and send us your best work now.